Good day everyone, I'm Christeta Curameng, a second-year nursing student. In this video, I'll be demonstrating the catheterization for the female patients. So first things first, we have the assessment. First thing that we have to assess is her overall condition, which includes her consciousness and her ability to participate with the procedure. Next is to determine when was the last time that our patient has voided or urinated. Then we percuss the bladder for distension and fullness. Next is to assess the external femur genitalia for redness, any kind of skin breakdown like lesions, discolorations, the odor, and even the discomfort of the patient. The next is to assess for any kind of discharge and drainage and tenderness from any localized area. The next is we have the planning, so it is our responsibility to always verify the physician's order before any conductive procedure. Then we prepare the client and the materials for this procedure, and as far as you can see, I don't have a real patient here, but ideally the position of the patient should be supine with their legs extended and slightly abducted, and the rationality of that position is to have an easy access to the urethral meatus to successfully perform the catheterization. Then of course, for the most important thing, we should always provide for patients' privacy and get their consent for us to perform the procedure. Good morning, Mom. I'm Christeta, your student nurse for today, and I will be performing for your catheterization to make your bladder to empty it of urine. Is that okay with you, Mom? Alright, Mom, thank you. So after introducing yourself to the client and identifying your patient's identity by letting them state their name and explain them the procedure and why it is necessary for them to cooperate, because it might be the physician has ordered catheterization because the patient bladder is distended or there's a need to obtain a urine specimen. Then of course, we should tell our patient honestly that during this procedure, it might be painful but it can be tolerated or it is tolerable. Then draping them properly by exposing only the female genitalia. So before we start our procedure, make sure that we have it here all the necessary equipment that will be needed in the entire process. So next, we should position the patient depends on the gender. For female patient, on back with knees flex and thighs relax so that hips rotate to exposed perineal area. Alternatively, if patient cannot abduct leg at the hip, patient can be side lying with upper leg flex at knee and hip, supported by pillows, and the rationality on this step, patient should be comfortable with perineum exposed for ease and safety in completing procedure. So next, we are now place a blanket or sheet to cover patient and expose only anatomical areas. This step helps protect patient dignity. Then after placing the cover sheet, waterproof pad, and fenestrated drape, we will now proceed with glancing the meatus with a cotton ball using the forceps. So using your non-dominant hand, we're gonna spread the labia and clean it with a cotton ball. So the techniques in cleaning the meatus from farthest to nearest in an anterior-posterior direction. So first, we're going to wipe the left side up to bottom, then dispose it. So using our cotton ball, we're gonna clean the labia. First, we're gonna spread this. Dispose. So after cleansing the meatus, we'll now proceed with the insertions of the catheter, and I will just want to mention that the size of the catheter for female is French 12 to 14 and the length of the insertion should be around 3 to 4 inches. So now we're going to use the catheter and put it on inside the urethra of our patients. So Here, I will start holding with the catheter. As you can see, I don't have here a real catheter, so I just provide and make a substitute here. And ideally, the tip of the catheter should be added with lubricant. But since I don't have one, let's just say that ideally the dip. So using our non-dominant hand, we're gonna spread the labia. Then, to expose the urethra and to properly insert the catheter to the urethra. Then next, we're gonna instruct our patient to do the inhale and exhale. And as she inhale, it serves as a distraction, and the exhale, that's the time when we insert the catheter. So, mom, can you take inhale and exhale for me, mom? Alright, mom, inhale, exhale, inhale, exhale. So we will be feeling the resistance, and that's okay. We will just continue instruct the patient to inhale and exhale. So after inserting around 3 to 4 inches and you have observed that the urine flow, that's the time that we will further more advance around 1 to 2 inches through properly anchor the balloon. Now that we have successfully inserted the catheter inside the urinary bladder and that it is properly anchored, we will now place the collection bag just below the hip to prevent ascending backflow, and make sure to take the tube at the inner thigh to prevent tension and pressure in the urethra to make our patient feel comfortable. So we're gonna take the collection bag and place it just below the hip at the bed frame. Then after assuring all the procedure is okay, we're now gonna dispose all the materials that we are already used. Then after proper disposal and removal of gloves, we will now be assisting our patients in a comfortable position. Then after that, we will now documenting the catheter procedure, which includes the date and time, the catheter size, the client's reaction, the characteristic, and the amount of urine. So this is the end of this video. Thanks for watching.